Bloomberg Audio Studios. Podcasts, radio, news.
It's something that should have been done a long time ago. It went crazy during the Biden administration. They went totally crazy, what they were doing, and the money they were giving to people that shouldn't be getting it, and to agencies and others that shouldn't be getting it. It was a shame. Tremendous fraud.
Medicare will become great again if they continue to support the poor people, those who are in need of, especially the medical care. That's what I think.
Talk to the average American. Do they want to see people dying because of assistance cut off? There would have been a very clear and particular way to reform the foreign assistance sector.
This suspension was immediate effectively. So that means if yesterday your employees had to come back the following day to office, you had to stop them because you had no money to continue with them.
At the core of this is about an anti-rights agenda. This is not about the economics of making countries such as South Africa and other African countries more independent. This is a direct attack on the humanity of LGBTQI people, of women, of girls, of children, and other marginalized groups.
One of President Trump's first actions after taking office was to take aim at USAID. And last week, more than 90% of the agency's activities in Africa were told to cease, bringing an end to decades of programs tackling poverty and diseases like HIV, tuberculosis, and Ebola. In this special episode of the Next Africa podcast, we hear from our reporters from all corners of the continent about what impact this decision is having and how countries and aid organizations are responding.
The future is uncertain because the government of Kenya actually announced that they only have stock for 6 months. So if they don't do anything right now, it's going to become a public health disaster.
I'm Jennifer Zabasajja, and this is the Next Africa podcast, bringing you one story each week from the continent, driving the future of global growth with the context only Bloomberg can provide. We start this week in West Africa. Over the past decade, the U.S. has provided more than $7.8 billion in aid to Nigeria, supporting everything from agriculture to HIV medication. But now, this may all stop. The Nigerian Foreign Minister, Yusuf Tugar, gave his reaction to Bloomberg earlier this week.
Nigeria has never been reliant on aid. What we have always sought for is strategic solutions to the issue of risk so that we can partner with countries and mitigate risk. So what we were taking in terms of development aid is really not that significant, and it's being covered.
So what does this mean for Nigeria? Our reporter, Nduka Orjinmo, is based in Abuja. I started by asking him what USAID actually funded in the country.
When you look across the country, you see the activities of USAID, cut across. So you go to some villages in southern and northern Nigeria, and then you see, boreholes that have been built by the USAID. But I think their most prominent interventions were in health, and this cut across malaria, tuberculosis, and most importantly, work around HIV and AIDS. Nigeria has the most people living with the condition in West and Central Africa. And that funding went a long way in providing affordable treatment for them, went a long way in providing, things like the kind of support services that they need, in funding NGOs that really worked with them. There's an agency in Nigeria that is basically dedicated to work around HIV and AIDS. And that agency said 90% of their funding over the years came from USAID. So it shows you how immense, that contribution was.
But at the same time, Nduka, we've been hearing from some Nigerian officials saying that they've actually budgeted extra money to fill the shortfall that now exists. Is it enough to actually make an impact?
Well, the National Assembly, they've budgeted $200 million to cover what they say, the holes in the sectors that will be left by USAID. If that is enough is what we don't know until they begin to implement it. But my first instinct is to say it's not likely going to be enough because there are several other agencies of government that have not really reported to the budget ministry how much of their programs will be impacted by the withdrawal of aid. So I'll give you an example. The Nigeria Bureau of Statistics, they do lots of the surveys around the economy, so that would be inflation, GDP, unemployment. A chunk of the funding that they get comes from USAID. Now, it's not a direct funding, so it comes from donor agencies that have also received some funding from USAID. So I guess these agencies have not really calculated how much they'll be losing. But I don't think $200 million is going to plug that hole. But what it means is that Nigeria at least has a fallback option, especially in that critical sector of health, where the government could not afford to let most of those programs in the health sector, freeze because USAID funding had been paused.
Well, and we know from the pandemic, I mean, you can plug a gap for so long, right? You don't know what is coming ahead. So what is at risk if some of these programs and if some of these stopgap measures are not actually sustainable?
A lot is at risk, Jen, and it's quite hard to imagine what the repercussions would be. So you're talking about HIV and AIDS, and Nigeria has never really got a grasp of the situation here, where you still have, despite these interventions, you still have, cases that keep going up. And then you look at malaria, which is quite endemic here. And then things like tuberculosis, that's going to be quite devastating on the population. And don't forget, a crucial part of this is the role of poverty in all this situation. Most people who depended on those services provided by USAID, that funding, were poor people, in the rural areas. And so imagine now they have to provide those drugs for themselves. Imagine also, that hospitals that they are used to visiting in their neighborhoods shut down because they no longer have that funding. So the consequences further down the line can be dire, unless something is done, in the shape of more funding, either from outside or the Nigerian government basically redirecting more of its resources to those holes now.
And Nduka, you're obviously on the ground there. What are people telling you? What are some of the concerns that they're expressing at this point, given how fast things have been moving since we heard aid was being pulled?
I've heard from people working in Nigeria's northeast region. So this is the area that has been affected by years of fighting insurgency and Islamist insurgencies in that region. So that's Borno State, that's Yobe State, parts of Adamawa State, and that's where you have the bulk of these interventions. I've heard from people who are working at several UN agencies who've had to, close certain departments, who've had to close certain units, certain programs that they are working on. And someone working in the agricultural sector was saying, look, Nigeria was going to face food insecurity this year that will lead to millions of people, facing starvation, because there was a huge flooding last year that destroyed lots of farmlands in the north. And some of these programs, some of this aid was going to plug that hole. And now this has been cut, it's going to get worse. And you could hear the deep concern in this person's voice. There's no help coming from anywhere, for this UN agency, which is quite sad. So you think of people, millions of people, that have been affected by years of war, and the only help that they knew, was aid coming in via, the American people. All that is now gone, and there's no immediate help coming to their rescue.
To East Africa now. As well as funding health programs, USAID was responding to the civil war in Sudan, funding emergency kitchens across the country, which may now need to close. Our reporter, Simon Marks, is based in Nairobi, and he told me what the immediate impacts of the cuts have been.
Well, we're obviously a number of weeks into the aid cuts that the US government has implemented, and they've been very widespread, in impacting a whole range of different health programs, from HIV treatment to tuberculosis to malaria, to vaccine research, to the ability of US officials to engage in the spread of Ebola in neighboring Uganda. And all in all, I would say that there are a number of NGOs who get direct funding from the US who are looking to, find money from elsewhere. They've had their funds frozen, and so programs have stopped. As well as that, countries like Sudan, where there is a famine, terrible famine unfolding in many, many different regions. In NGOs, soup kitchens that got money from the US, for example, have stopped all over the country. So it's really aggravated the lives for many.
And Simon, there's been a bit of conflicting news about whether partially some of the aid has returned or not. But if it doesn't, in fact, return to the levels that we saw before, how are people who you speak to, how are they responding to it?
Yeah, indeed. So as you said, some key sort of life-saving funding, there has been news come out that this could come back, that there are indeed waivers. I'm not aware of anything in Kenya where money's come back initially, because people are just freezing while they see the final decision at the end of this 90-day period. If that happens, I think governments are going to have to shift gears. They're going to have to find money from elsewhere, either inside their own budgets, or they're going to have to go looking to other countries to fill the void. And this has drawn out a debate locally about, obviously, just US influence in general and soft power, the ability of the US to sort of chip in on key areas such as health and education.
You mentioned funding. Do some of these governments have the capacity in their budgets to fund some of these programs, or will they look to external partners, as you say, to fill the bulk of the gaps that may exist?
Well, in the case of Kenya, for example, the government has said, that this is a wake-up call. It's actually also an opportunity for the government to really, I guess, grab the bull by the horns and, fund its own health sector more. But the reality is that it's a heavily indebted country. There is a huge amount of annual revenues going out just to paying off interest on debt. We've seen protests recently in Kenya that even managed to storm the national parliament as a result. So there isn't really much wiggle room for a country like Kenya. And I think that's just one example, and Kenya is one of the more performing economies in the region.
This is a life-saving situation, and we cannot sit and wait and bargain on human life. So for us, it's about the human life, the lives that we need to save. So something needs to be done urgently.
And finally, Simon, Sudan, you mentioned that. What could this mean for the country if, in fact, aid does not return in the way that it was there before?
Sudan is obviously at the very sort of bottom of the pyramid in terms of the absolute necessity, right, for international aid. I think there is a growing famine. The number of regions suffering from famine is growing quarter by quarter. And the US is a massive component of that aid, either through the World Food Programme or through other NGOs present in the country. So it's a devastating blow. I think there's a lot of hope, right, that once certain officials come in, Africa officials related to the State Department come in and start, actually talking to regional officials, that maybe some of this funding can return. But Africa is not the biggest focus of the US administration. There's other regions that are getting more focus at the moment. And so we're still waiting for that to happen.
So it's unclear how this could play out for the Sudanese people at this point.
Yes, unfortunately. One of the really successful organizations to bring food to people in Sudan were this network of soup kitchens. And they've just literally stopped. They were dotted about in rural areas, also in Khartoum, the capital. A lot of people relied on them, thousands and thousands of people.
Stay with us. When we come back, we'll hear from our healthcare and consumer reporter, Janice Kew, on what the reaction has been from the healthcare community and how they might fill the shortfall. We'll be right back. Welcome back. Today, in a special episode of the Next Africa podcast, we're focusing on the impact of the proposed near total closure of billions of dollars of USAID projects in Africa. Janice Kew is our healthcare and consumer reporter based in Johannesburg and has been covering this for well over a decade. I started by asking her, what role did USAID play in Africa?
Broadly, it was responsible for development assistance, and the programs were wide and varied across thousands of initiatives in public health, disaster relief, socioeconomic development, environmental protection, democratic governance, and education. Some of the key projects included ones around health research, working to find solutions to HIV, as well as food insecurity, which is a big issue on the continent.
So talk about the impact so far that you've seen from the suspension of some of these programs. Where is it being felt the most?
The recipients of this money have halted work and fired staff, and that abrupt manner has devastating consequences, especially for people living with HIV, as well as for other key and vulnerable populations. Desmond Tutu Health Foundation Chief Executive Officer Linda Gale Becker says South Africa stands to lose 25 years' worth of HIV investment if government can't fill the gaps, with more than 500,000 HIV-related deaths expected to occur over the next decade because of the terminations. A US-funded HIV vaccine trial where South African Medical Research Council had teamed up with scientists from 8 countries on the continent has also stopped because of the USAID moves. And, from these examples, it's very clear that the impact is really, really wide-reaching. And it's not just that the funds aren't there, it's the manner with which it's being done, the abruptness of it that is really key and very, very destructive.
So then how concerned are some of these aid and health agencies that you listen to time and time again? How concerned are they about this?
They're very concerned. No one knows where the funding will come from and whether any of it will arrive in time. It's really quite overwhelming. I mean, when intricate and interlinked programs are halted so abruptly, even if the money comes in from elsewhere, it's hard to restart and build up again, not least because certain programs are only successful if patients actually come into the clinic or the facility and get their meds. We saw this with COVID-19 when people were told not to come in, they didn't. And then it really takes time to get people back in later. We've seen this sort of the ripple effect of that with vaccinations across the continent. A lot of vaccination programs, routine vaccination programs for children specifically, halted during COVID-19 because people were told only to come into a hospital clinic, in an emergency effectively. And so these things really do take time to get back up and running. There's also a lot of distrust that comes in when things are halted so abruptly. It takes a lot of work working with people on the ground in communities to build that trust. And when something like this happens, that trust is often destroyed. And so people, just to go back to the vaccination programs, routine vaccination programs for children, parents, it isn't just that you have to make up the backlog because certain shots have been missed at milestone ages, but there's also a distrust issue, and then people wonder if it's really necessary, and it's just very, very disruptive.
Is that how people on the ground would describe it to you, Janice, or are describing it to you, disruptive? I mean, what else are they telling you?
Chaotic would be another word. I mean, Yvette Raphael, who I interviewed last year for a story about HIV and aging, heads up a South African advocacy group for the prevention of HIV and AIDS. She said last week that the Trump administration, according to her organization, has globally declared war on the right to health. In South Africa, health is a right. And there are scores of people who are describing the news of the halts as chaos, as their organizations have told the bulk of their colleagues they no longer have jobs. There are scores of people who were getting regular meds and already have no supplies for life-threatening diseases, and they've got no idea where or when to get more. For them, it's quite literally feels like a death sentence. There was a briefing held last week when the news started flowing through, and these emails had come for our region on the African continent. A lot of these emails had come overnight. And people from these various organizations, thousands of them, were trying to get onto this briefing. They actually had to give the link to people afterwards because so many people were trying to get on. And the people who spoke, many of them were incredibly emotional. I mean, on the verge of tears. It is that devastating for people. It's that real.
So, Janice, what is the likelihood we'll see someone else at least try to fill the gaps that USAID is now leaving?
Africa CDC says that they have had some money come in from Japan and Korea. There is an expectation that the Middle East might step in to some degree. A lot of the billionaires across the globe who have philanthropic branches or organizations are trying to see what they can do. But I think even for them, it's quite overwhelming. The amount of money, at least from the Africa CDC points, what's been offered so far from Japan and Korea, they would never say that it's insignificant because it's not, but it's really just the tip of the iceberg. And so to really fill the gaps fully is going to take a lot of work. Again, these programs didn't happen overnight. This amount of money wasn't one big lump sum at the start of something. It's been incrementally added over years and years. And so it is very difficult to fully fund those gaps. And it's difficult to do it in a rush. Had funds been withdrawn in a more orderly manner, it definitely would have been less devastating.
And thanks so much to our reporters, Nduka Orjinmo, Simon Marks, and Janice Kew. You can read all of their coverage and reporting on the suspension of USAID programs across Bloomberg platforms now, including the Next Africa newsletter. We'll put a link to that in the show notes. This program was produced by Adrian Bradley and Tiwa Adebayo. Don't forget to follow and review this show wherever you usually get your podcasts. I'm Jennifer Zabasajja. Thanks as always for listening.